Hello, this is Dr. Brian McClelland, and I'm now going to continue on with part 2 of our article review on nutrition and wound healing. Last video we talked about protein, we talked about vitamin A, and we talked about zinc. Now we're going to talk about, let's start with vitamin C. So vitamin C is required for the synthesis of strong collagen. Severe vitamin C deficiency is known as scurvy, as we all know, and can occur after only 3 months of total vitamin C deprivation. Deficit in vitamin C are more likely among smokers because of the oxidative effects of tobacco use increases the need for ascorbic acid or vitamin C. Consequently, the U.S. RDA of 60 to 100 milligrams per day increases in burn victims to 500 to 1500 milligrams per day because of this same need for this antioxidant and for wound healing. Some of the physical signs of deficiency includes swollen, spongy, bleeding gums, purpura and petechiae around hair follicles, and easy bruising. Megadoses of vitamin C, even when administered to patients with normal vitamin C levels, accelerates collagen formation above the degeneration rate of damaged collagen. Vitamin E. The role of vitamin E in wound healing is the subject of some controversy. In different studies, it's found to either be detrimental or beneficial to wound healing. Vitamin E does have an anti-inflammatory action. Vitamin E may also inhibit collagen synthesis. Vitamin E appears to enhance the immune response in a dose-dependent manner. Vitamin E increases antibody production by locally stimulating T helper cells and enhancing cooperation between T and B cells. Iron. Iron is a universal requirement for life and also essential for wound healing. A lack of iron would impair the proliferation of all cells involved in wound debridement and healing. Anemic patients exhibit delayed wound healing, for example. Many forms of iron supplements are available, but preparations of iron sulfate, gluconate, and fumarate are less expensive and more effective. Ironically, since iron is the universal requirement of life, iron deficiency is associated with a decrease in the incidence of bacterial and parasitic infections. Well, that summarizes the article on nutrition and wound healing by Dr. Mary Mazzotta, M-A-Z-Z-O-T-T-A. Let me just double check that spelling for you. Yeah, M-A-Z-Z-O-T-T-A, in the Journal of American Podiatry Medical Association, Volume 89, number 9, pages 456 to 462. You can find this article also posted on www.dental-marketing.org. Thank you.